Hi, everyone. Thank you so much for joining us at the webinar today for SOPHIA. We are a community of health and all policies practitioners. I'm Sandra Whitehead. I'm the current president of SOPHIA, and it's my privilege to welcome you here today. We are going to hear from a well-established health and all policies project from 3 council members in Santa Cruz, the city of Santa Cruz, California. My connection to this project goes way back to about 9 years ago when I was at the National Association of County and City Health Officials. And I worked on a project that was funded by the CDC to establish a health and all policies community of practice. And the city of Santa Cruz was one of 9 participants, and Councilwoman Watkins was actually a member of that collaborative. So I am so pleased that they are still going strong after all of this time. And thank you all so much, Councilwoman Bruner and Councilwoman Johnson, also for joining us. I'm so excited to have you here, and I'm going to turn it over to you now.
Well, thank you so much, Sandra. It's a pleasure to be with you all today and with you to talk about this really wonderful initiative and just the values behind it. So I will just briefly kick us off, and we will be co-presenting. I'm here with my colleagues, as was mentioned. We have Councilmember Shepard Kalantari Johnson, as well as Councilmember Sonia Bruner and myself. We all are comprised of the Health and All Policies subcommittee for the City of Santa Cruz, or the ad hoc committee we have. But before we started, I just wanted to introduce sort of the way health and all policies came into my life, and then it came into my campaign, and eventually as mayor into an ordinance. And just briefly, when I was running for office in Santa Cruz, back in 2015, 2016, thinking about a lot of the municipal government type of things and what really inspired me. And I was talking to my brother who worked in San Mateo in California here, and he worked in public health, and he said, "Hey, have you heard of this thing? It's called Health and All Policies." And I read it, and it immediately clicked for me, because what it did was showed how we can put our values of equity, of sustainability, of health, and all for all people into local government that in tangible, practical ways. And so when talking about it when I was campaigning, when talking about it in council, and then eventually moving forward with a outreach process, as mayor, it really was this journey to be able to put these values into action. And it's only accelerated since my 2 colleagues here today have joined the council and joined this as well. Okay, so I'll move on to the next slide. And I think, Sonia, this was you, but oh, there you are.
Thank you. It's so nice to be here. My name is Sonia Brunner. I'm in my 4th year as council member on the city of Santa Cruz. I was vice mayor in 2021, mayor in 2022. And this has been just a wonderful tool for us in our policy work. And we're so happy to share this with you. So we hope to cover these items here on the agenda, and we'll leave room for Q&A at the end. And so next slide. And it's back to Martine.
Yeah. So as I was sharing briefly, what the thing about health and all policies was for us is about, and for me specifically, I'll speak for myself on this, is about how I could put my values, what I feel in terms of the passions that I have, into action, and how that can translate into policy outcomes. And that's the why that really connects you to the work, especially as times can get kind of challenging. And I know my colleagues feel a very similar way. And so I'll have them explain their why as well.
Shebra?
Sure. So my name is Shebra Kalantari Johnson. I am in my 4th year as a council member and will be serving another 4 years with Councilmember Brunner. And I care deeply about the values of courage and equity. And these are some of the reasons why I've engaged in this work. And I'll share my journey in a little bit, but I started out as a consultant with the city, specifically to work on health and all policies, and was inspired to run for council. I'm going to just share a brief personal story with you all. I know that we all have moments and incidents that are embedded in our memory and in our minds of kind of the start of our journeys or the start of these values that are core values to us. So I'm going to share mine. I'm going to invite you to reflect on yours, and then we'll open it up to an exercise that will participate via chat. So I'm originally from Iran. I'm from the northern part of Iran. I immigrated and left Iran in 1984 and made it here to the United States in 1985. There was a journey in there. But my story goes back to when I was 5 years old. So if you do the math, it's late 70s, early 80s, post-revolution, post-Iranian revolution. And we lived by the sea, by the Caspian Sea. And my dad and I were on the beach. And I was with my uncle and cousin, and a morality police came to us and said to my dad, "You are unfit to be a father. You're unfit to be a father because your daughter," me, at the age of 5, was wearing a bikini, and that was inappropriate, right? Post-revolution, morality police, the name says it all. And I remember at that age thinking, wait a minute. How come my uncle is not unfit to be a father when my cousin, who happened to be a male, was wearing less than I was? And I share that story because that has been in my memory. And for a while, I thought I made it up. I had to ask my parents. I said, no, that was really one of the incidents that was the impetus for us to leave Iran, because we were looking for a more equitable life for you and your sister. And I do remember at that time thinking fair and unfair. I didn't have the words for equity, but fair and unfair. And the courage to turn away from the morality police, the courage to leave our home country, our birth country, where all our family was. So courage and equity. I started out by saying I care deeply about courage and equity. And for me, being in this work and engaging in health and all policies, this gives me a framework to embody those values. So that's my why. Sonia, I'm going to invite you to give your why, and then I'm going to invite the attendees here.
Thank you. I ran for office in 2020. This was a very interesting year with COVID, but it was also what I consider the year of George Floyd. And that was kind of the final thing that made me look at how I could be a contributing member of my community. And I had come from a background in business, but I was also a single mother, a Black woman. I lived in public housing. I also sat on the Housing Authority Board of Santa Cruz County. And for me, it was always about equity and really being engaged in the community, supporting various aspects through volunteer work, and just improving the values in our community. And so finding out about health and all policies, like how we translate our values into systems and policies, was the next step. And this was the framework that really appealed to me. And we'll go into some of the examples and how we've been able to apply that. So next slide, please.
Actually, before we go to the next slide, one moment, because I am going to invite all the attendees here. to do what we just did. So just take a moment, reflect on your why.
Mhm.
You know, each of you are leaders. Each of you has had a leadership journey. And we know that there are challenges that come every day, every moment when we're doing this work. It can get really overwhelming. It could lead to burnout. But when I ground myself in my why and why I'm doing this work, it emboldens me. It gives me courage to keep moving. So take a moment to think about your why. It could be from a memory, an incident that you had, could be what inspired you to do the work today. And just put in the chat what you care deeply about in just a few words. Don't be shy. There we go. Beautiful.
I'm just going to read a few if that's okay. Well, they come up. I see courage and equity, equity and well-being, justice and wellness, and courage and safety, environmental justice and well-being for all, committed to equity-focused and policy systems, environmental changes, elevating voices that have been historically silenced, in a healthy community. Great. Great. Thank you.
Thank you all. Okay, we can go to the next slide.
And I'll kick this one off just briefly, as I kind of spoke a little bit about in the introduction. You know, one thing when I was mayor was we were in the city of Santa Cruz having a really divided council, really challenging time. And one of the traditions when we didn't have a directly elected mayor, we would have a mayor that would rotate, as the mayor would sort of choose their area of focus, their project, or what they wanted to sort of have a dedicated time spent on. And mine was on health and all policies, despite all of the challenges that our community was facing politically and just in general. And so we had an opportunity, and I say we because a lot of the staff, as well as actually Shepherd Kalantari Johnson at the time was our consultant, we did a lot of work really going out to our community, doing listening sessions, listening to our staff members, really doing our best to say, hey, what does this mean for you? What does a healthy community look like to you? And how can we all work together to know what role we play in designing that community? And despite a very divided council at the time that rarely ever met a unanimous consensus on items, we were able to get full consensus from the entire council on the ordinance language. And that was formally adopted in 2019. And as a result, we also attached a level of staff time and money to ensure that it was adequately funded to ensure ensure it could be operationalized. So that's sort of the entry into our journey. And I will hand it over to my colleague, Shebra, to take it from here.
Yeah, so one of the first things we did is, you know, the health and all policies, I think, as you all probably know, can be up here quite a bit. Right? It's heady, it's theoretical, it's these big concepts of equity, sustainability, well-being. So we wanted to make sure it was actionable. And so we committed to developing a work plan. And as Martine said, I was the consultant. As I said earlier, this was part of the why I was inspired to eventually run for city council, to see what's possible, to see how the ability for a city government, which, as you know, could be very bureaucratic, to take these concepts, these frameworks, and turn it into something actionable. So we committed to developing a work plan. Our work plan includes community well-being indicators, which we'll talk about in a little bit, and very specific action steps. So now every year Our staff that works with us with the Health and All Policies Subcommittee comes and gives a progress on the work plan. We revise our work plan, and we have a new work plan that comes to us January of each year. Sonia, if you want to take the next piece.
Thank you. So in 2021, when I was vice mayor, we worked with, there was an action of artists that came together, and the Black Lives Matter was painted on the road, and simultaneously I worked on trying to figure out how to really put in writing a resolution and commitment from our council body that would show and recognize, you know, the existence of racism in Santa Cruz, white supremacy in the community. And we worked to revive the Health and All Policies City Council Committee. And I worked with then Mayor Donna Myers, and we wrote an anti-racial discrimination resolution and declared racism a public health crisis in Santa Cruz. And, you know, it tied into what I had mentioned earlier in some of the work that led up to me running for city council historically in Santa Cruz, California. Our Black population is very low. I think it was last at 1.6% in the county, and our city council body was not very diverse in representation. Was traditionally, historically, people who were homeowners over the age of 65, and it wasn't representative of more community that we had. And these were all of the culmination of kind of context and background that led to this really huge step in the work with our committee. So reviving it in 2021, you know, Martine Watkins had laid the foundation, and I really wanted to, you know, keep this going because I saw the value in it, and I know that my colleagues did too. So next slide. So once our committee was established and revived in 2021, we set out on really integrating it into our city governance, and we joined GARE, which is the Government Alliance on Race and Equity. It's a national network of government agencies that work to advance racial equity and opportunities. And we started integrating health and all policies in all agenda reports. So if staff wrote an agenda report, at the bottom, the health and all policies tie-in had to be there to show how it was through the lens of health and all policies. And we also use the pillars in our strategic plan development. We started using it in budget and decision-making, budget development. And then we conducted a City Like Me survey. And really that was huge because of the value of representation that we saw, not only on our council, but in our advisory bodies and the committees and commissions. And we really saw that we had to look at incorporating that the pillars of health and all policy into that. And so what that did is it really informed some actions the City Like Me survey. So next slide. Here's an example of, some of the information we found out and how it led and informed some actionable goals. And we found that there was underrepresentation of renters serving on our commissions and committees. So we set a goal to increase that by 2026 by 30%. There was also, underrepresentation of our Hispanic, Latina X community. And so we set that goal, and also to explore how do we get more youth involved. And from that was a youth liaison position that was created. And so the data was really key. And I think that was, our first step in what we were seeing, but we needed data to really fine tune and inform what steps would be next in terms of integrating it into our policies and governance. Next slide, please.
Thank you.
And
go
yes, I'll hand it over to Martine.
Thank you, Sonia. And thank you for the overview. So we wanted to really share a few specific examples that we're working on or have worked on that really show how these considerations, those pillars of health and all policies, influenced those decisions and policy actions. And we continue to try to make sure that we integrate health and all policies in all of the things that we do and consider, from small decisions that don't necessarily feel like have a huge impact on health, but how are they potentially impacting health, to some of the larger decisions that we make. And that agenda report example that was shared and budget example really show tangibly a small shift that can change a mindset around everyday decisions. But there are also some really big ones that we really, the three of us have really put a lot of time into. And so I'll start by sharing the first one, which is the sugar sweetened beverage tax, currently underway in the city of Santa Cruz. Next slide, please. So as you can imagine, this visual is quite breathtaking in a very challenging way to witness. The industry of big soda has targeted youth and especially people of color for many, many years. This is a very old picture that we found for our campaign. But why did we do this? I mean, let me back up a little bit first. So we tried to bring forward a sugar sweetened beverage tax to the city of Santa Cruz in 2018. What happened at that time was that the beverage industry, which is a very powerful industry internationally, really, was forcing the hands of our state legislators, basically saying if they didn't pass a law that stopped local governments from being able to pursue sugar sweetened beverage taxes, they would make something statewide that was going to be even harder for local governments. And they put them in a real hard bind. And essentially, the state legislators passed this policy saying that local governments can no longer pursue sugar sweetened beverage taxes. At that time, the city of Santa Cruz had already put on the ballot sugar sweetened beverage tax. So we had to schedule a special meeting to then take it off the ballot because we would have been penalized if we had moved forward. There was a couple of legal challenges that moved forward and ensued beyond 2018, really challenging the state's authority to limit local charter cities like City of Santa Cruz from being able to ask our local residents to consider a measure like this. That has then now opened the door for lack of, without being penalized, to have these types of measures go through. So fast forward to today, Shebra, Sonia, and myself worked on a committee really exploring what this could look like in the city of Santa Cruz for almost a year, talking to a number of stakeholders and partners and people who work in businesses to understand what we could create locally to work for the city of Santa Cruz. And so we were able to do that. We got unanimous support to put it on the ballot, and it is currently on the ballot in November. So why big soda, and why do we want to tax it? What we know is that sugar sweetened beverages are the highest concentration of sugar in the American diet, and as a result, really influence the health outcomes of individuals, increasing diabetes and obesity and other health outcomes that are negative. And what communities have done in our state and nationally and internationally is they've found ways to tax beverages that are highly sweetened, decrease use. As a result, people will choose a healthier option often, and often a cheaper option. So then they have less sugar in their diet, which then leads to better health outcomes. And then often those communities use those dollars to be reinvested into health and wellness, and using a tool, which is an oversight committee, advisory body, to inform how those dollars can meet the health needs of our community. So our tax is a 2-cent tax on the distribution of sugary sweetened beverages in the city of Santa Cruz. And it is really geared at all of the things that we value in health and all policies in terms of the pillars of support. We're 100% trying to influence health outcomes. We want them to purchase less soda. We want people to choose healthier options. And as a result, that will increase health outcomes for individuals. We certainly want to go through a lens of equity. We did our best to also not penalize our small businesses that can sometimes struggle or feel like this could be an additional struggle. We also have it built in terms of our advisory committee to ensure that as we look through our reinvestment of any revenue brought forward as a result of this distribution tax, that these dollars go into the communities and the people who need the money the most and the supports the most. And so the advisory committee is comprised of certain people from various sectors who represent disadvantaged communities and other special areas that then will inform how this can be reinvested to support equity and sustainability. One thing we often don't talk about in terms of relational is how these products now are the producers of these products. Coca-Cola and PepsiCo are the top 2 producers of plastic pollution in the world. And there are impacts to our watershed locally, but there are impacts even greater to our entire communities throughout the world. And so when we think about sustainability, we think about decreasing that type of purchase and hopefully a healthier purchasing option that is also around sustainability for our environment, but also a continual investment source for sustaining our community and how we can continue to invest in health and wellness. So that's just one example. We'll know the outcome. We'll be able to hopefully share it with you all after the election in November. And the 3 of us are currently working on this campaign, which is Yes on Z, a safe, healthy Santa Cruz. And it's a 2-cent distribution tax in the city of Santa Cruz for health and all policies, values in action. And I will hand it over to my colleague, and I think that would be.
I'll take on the next one. Is it oversized vehicle?
Yes. Next slide then, please. Thank you.
Yes, I'm happy to talk about this ordinance. This is a great example, the oversized vehicle ordinance, of an issue that was affecting our city, our environment, our people, and how we approached it using the 3 pillars of health, equity, and sustainability, and through the lens of health and all policies. And so we had a real growing population of vehicles that were parking on streets long term and spilling out, and there would be side encampments and sidewalks blocked, dumping happening into our storm drains, just a lot of impact. And we worked with our county health department and county outreach staff and worked to collaborate and develop a kind of a rehousing sheltering plan. But more than that, we didn't want to just have this be where our police department and police officers go out and ticket vehicles. That wasn't I mean, there's more to this than that, and that wouldn't help anybody in any of these situations. And so we started diving deep into creating this policy, and really, again, the equity, public health, and sustainability, and really making sure that decision makers and the community was informed about the health and equity and sustainability impacts of the options, the policy options during the development process. We really worked hard with community, and we went out several times and knocked on some of these vehicles and worked with neighboring residents and neighboring businesses, worked with city staff, and the actions and the final outcome really support the pillar of equity, because we decided to incorporate services such as safe sleeping options and shelters, safe parking options we stood up, and case management services that support those that are living, either experiencing, houselessness or wanting those connections, and supporting the public health by providing mental health, case management, hygiene resources, and land management. We stood up shelter and hygiene resources at the shelter. We did different tiers of safe parking programs. One is a 24/7 program. The other is an overnight program. And the other is an emergency parking program if there's a mechanical problem. And so we really found that there was a decrease in the amount of litter, debris, human waste that was disposed of improperly. And there was an uptick in pathways to housing, and a lot of positive outcomes in the overall health that is consistent with the 3 pillars of health and wellness policy. Next slide, please. I will hand it over to Sarah.
Thank you. I get this very fun one. So this is another ordinance that we recently passed, the gas-powered leaf blower ban. And I'll share a little bit of background before I talk about the, how this really embeds the 3 pillars of health and all policies. So we had state law that passed, and as of January 2024 in the state of California, the sale of gas-powered leaf blowers have been banned. This is a part of an environmental response to climate crisis that the state has issued. We have a group of community members that have, for the last decade, been trying to ban the use of gas-powered leaf blowers. And again, I'll talk about, the reasons that they really brought forward to us is, again, environmental reasons as well as health reasons. And I'll talk about the equity piece in a moment. So they've been working on this for a decade. There was no traction. And then this state law passed. So they came back to council, spoke to those of us who are on the Health and All Policies Committee, and we decided this is worth looking at. Environment, the sustainability component is very clear. There's lots of data that shows that there are greenhouse gas emissions that are emitted from these gas-powered leaf blowers, and they do impact our climate crisis. There's also research that shows the health impacts that the fumes breathed in by those who use gas-powered leaf blowers has long-term health impacts on individuals that use them. And then in terms of the equity pillar, we find that, at least in California, this disproportionately impacts low-income and BIPOC community members who might be doing this work. So that widens the health disparity gap in general. So that's one of the inequities that we found there. So we decided this was worth looking into. We did 1.5 years worth of work. Talked to community members, we talked to landscaping businesses, we talked to landscaping individuals who may not have businesses, we did surveys. And we found that really the majority of community members were in support of this, but not in support of it in a silo and done alone, similar to what we just discussed with the oversized vehicle ordinance. You can have an ordinance with the accountability measures, but what about the other side of it? How are we supporting those individuals? So we thought through that, and what we landed on as a Health and All Policies Committee is that we would move forward with an ordinance if we could find sources of funding that would help our community members and our landscapers have funding for the purchase of these new equipments, because they're not cheap, they're expensive. So that would be inequitable. So that's what we landed on. We brought it before the city council. It did pass unanimously. However, things aren't linear. Things, as you all probably know, are circular and iterative, and they move this way and then they move this way. So one step forward, two steps back. That is the case with our gas-powered leaf blower. After we passed this, we learned that there was a little bit of a glitch, that we were given incorrect or incomplete information, that the funding that was available through these groups that had funding required that it would be a registered landscape business. Well, the case in California and in Santa Cruz is that not all our landscapers are registered businesses. Some of them may be undocumented. So that's not going to work for us. So as we speak, we have revisited this and are rethinking our approach. So our Health and All Policies Committee had a discussion. We're going back to City Council, I believe in our next meeting in October 22nd, we're going back to City Council and asking to put a pause on this. We want to make sure that there's funds for these landscapers for them to be able to purchase these new equipments before we put this ordinance. The other thing that we've did is that when this, so we were going to put a pause. I think we've given ourselves a pause of 8 months or so we can find that funding. And then once we initiate and start implementing the ordinance, we are going to wait another 6 months. We're going to give another 6-month sort of stretch to make sure we do robust outreach and engagement so that everyone knows about it. So that's Health and All Policies at work with this ordinance. Again, not linear, iterative, circular, and I think that's the beauty of Health and All Policies is when you really apply the lens of health, equity, sustainability, if one of those pillars is missing, it's not going to work. And in this case, our equity pillar was missing without the funding. So we're taking a pause. We're going to take another look at it. I don't have a slide on this, but this is hot off the presses, and I have to share with you guys that another piece of legislation locally for Santa Cruz that really started in our Health and All Policies Committee is the ban on filtered cigarettes. This is a landmark ordinance that passed by the Board of Supervisors just yesterday. Our County Board of Supervisor was previously on our City Council. He brought this forward. We took it up as a Health and All Policies Committee. We said, this is a little bit too big for us as a city. How about as the Board of Supervisors takes it up, and then we'll see what happens and we'll follow suit. So this is, again, hot off the presses, passed unanimously. I think first of its kind, at least in the state of California, to ban filtered cigarettes. And I won't go into the details, but I think it's pretty obvious that, the filters on cigarettes have plastic components that impact our environment. It is an equity issue as BIPOC and low-income populations are targeted for the purchase of cigarettes. And of course, we all know the health impacts of use of cigarettes. So I had to share that with you. We'll go to the next slide. Next slide, please. Okay. Don't get too overwhelmed. I know there's a lot here. We're not going to go through it all. The purpose of this slide is to show you, as I mentioned earlier, this is rooted in data. We know that Health and All Policies, it's based on these 3 pillars, but you change what you measure, right? So we need to have accountability for ourselves. We need to have metrics. And so what we did with our Health and All Policies work is we aligned it with a larger framework that's happening within our county. It's called the core conditions. A decade's worth of work has gone into developing the core conditions based on SDGs at the international level. And so we've landed on, it's really small and you probably can't see it, but we've landed on these 8 core conditions around health and wellness, lifelong learning, economic stability, thriving families, I can't even read it myself here. Can you see that? Maybe we can make it.
One thing I think without reading the slide, the specifics, Shepard, one thing I would just say is a real component of health and all policies is knowing what you control within your sphere of influence in regards to the pillars, but working with those in other spheres of influence to help ensure that we're able to elevate health and wellness in our community together. We don't do education, but we work with our education partners in our healthcare system and our local county government. And so when you start to think about how we're measuring our indicators of success and wellness, it's factoring all of those partnerships into it. And that's essentially what these little slides are showing.
Yeah, thank you. Thank you. I made it bigger for myself, so I will read them. That's exactly right. What Martina said is exactly right. We cannot do this alone, and the city cannot do this alone. So what are the different sort of blocks of challenges that we want to address, and then who do we need to engage with, right? That's one of the core tenets of health and all policies is collaboration to address the challenges in our community. So it's stable, affordable housing, safe and just communities, healthy environments, community connections, thriving families, economic security and mobility, lifelong learning, and health and wellness. So those are our 8 core conditions. And then we identified specific indicators that we have put in our work plan and put in our health and all policies plan that align with these 8 indicators. And we're not collecting it all. There's other, as Martine said, there's other organizations and other systems and other entities that are collecting them, but we bring it back. We bring it back to see where are we at as a community in terms of these indicators that tell us if we're a healthy community. So that's core to our work. And I think I'll pause that there, and we'll go into this next slide, and we're going to stop talking now. We're going to invite you to share a little bit. We threw a lot at you. We went a little bit quickly. It's hard to fit all that we wanted to fit into in this time, but we want to share your insights. We are inviting you to reflect on these questions. What examples do you have that are different than what we presented? What are some organizational functional changes that you've made within your entities? What are your takeaways, and what inspired you from what you heard from us or others who are about to share? We'll take about 10 minutes or so, and I hope that you will turn your cameras on, unmute, and share your insights. And if you want to use the raise hand feature, then we can do it that way. This is a peer learning. I said at the start of this, when we were just getting started, it's a peer learning. You're learning from us, we're learning from you. So please share your examples, share your insights, share your takeaways. It's no fun if we don't hear from you.
Audrey?
A brave one.
I'm looking at the chat. See if there's insights there. There's questions there. You're also welcome to ask questions, but we'd also love to learn from you.
I guess I have an overall question.
Sure.
Is what it so Southern California, I'm from the Midwest. We have assumptions about the culture in Southern California when it comes to changes like this, but maybe you can talk a little bit more about community support or lack thereof for some of these policies. Are these easy wins? Are these not so easy wins? Like where is that dynamic? If you could share some more.
Martine, do you want to jump in?
Yeah, I'll just jump in because it's a really great question. And I guess I'll just sort of start that when I first started running for office and I was talking about health and all policies, people didn't really follow. And I would talk to an average voter and they'd be like, what are you talking about? It sounds like very academic. And so I learned early on that it has to be translatable to what that means for people's everyday life. And sometimes these policies are not easy wins. These were hard policies to pass. These are definitely not. But I will say one thing that I've noticed over the years is that there's now a community awareness about health and all policies. We've had community members who testify and say, you know, I don't know if this is really in line with health and all policies, and where's the equity in this? Or, you know, so they're talking about it in a really different way, which is really great. The other thing I will say about health and all policies in the city of Santa Cruz is we were very intentional about making sure that there was staff time dedicated to it, as well as some finance behind it, because there's a lot of great initiatives, a lot of great projects, but if you have no infrastructure to keep it moving, it makes it really, really challenging. So that's sort of a meta kind of answer to your question. And then I'll certainly invite my colleagues to respond as well.
I'll just chime in and say that we have a good portion of our city is very engaged, and a lot of people are not. And where we are, I think you mentioned Southern California, we're more Northern California, but you know, it really takes a lot of, for example, the oversized vehicle ordinance that took a couple of years and it's still ongoing. We had to not only work with the community, but all of the different groups of people to implement all of the aspects of it to get people to understand. And still it's with the California Coastal Commission. We have to have a permit to work through, you know, they're all very challenging, but I think what's important is for the community to understand how we bring policies forward, how we prioritize different policies, and how we look at policies. Really, how do we support our community? How do we support, you know, the environment, the people? And so I think, you know, that is translatable, and some people may disagree, some people may agree, but I think that's in any policy. But when you can ground it in these pillars, then it's understandable. There's also a housing question. I think in the chat, you know, housing affordability and availability. I don't know if you know, but Santa Cruz there was only 6% of the state that met their fifth cycle RHNA housing goals in every single income category. We were one of those cities. We also received pro housing designation, and we are doing it. We are really using health and all policies to build diverse housing stock at different income levels, different sizes. We can't keep building single family homes with 2-car garages and preserve open space and expect all our young people to stay. We have county health data that shows that by 2030, 1 in 3 adults here in Santa Cruz will be over the age of 60. And so how are we also preparing for that? These are all the things that we work with. And Shebra, I'll let you chime in too on that.
Thank you. Yeah, we had an opportunity this last year. It was time for us to update our housing element portion of our general plan. So we formed a subcommittee. I was part of that subcommittee, and we certainly used the 3 pillars of health and all policies as we were putting forward policy recommendations within our housing element. For example, we had a pretty robust component around affirmatively furthering fair housing, and that's you know, equity. We had a lot around you know, how we build housing so that it promotes alternative modes of transportation, right? Building dense housing around transportation corridors. So we were able to integrate these three pillars through the update of our housing element. And as Martine spoke to earlier and Sonia has spoken to, we've done a pretty good job in terms of housing, building housing. Now, there's been decades and decades of catching up to do. So our affordability, unfortunately, isn't there yet. But I expect to see a real turn, a real curve in that trend in the next 5 years or so.
I see.
Yeah, go ahead, Martine.
No, yeah, thank you. I appreciate your both your responses on that. And I think one other thing about the how just on housing is the awareness that it's not myopic, that every decision isn't made in a silo. It's all interconnected in terms of the health and wellness of our community. And so if we're thinking about development, are we thinking about mixed use? Are we thinking about transportation, density of outlets, liquor stores, such like that? It's all interconnected. And I think it opens up your mind to get a bit when you're thinking about specific votes on housing projects. I do see a question in the chat, and it's really, I think, a very deep question around how do we see a lot of this big systems change to find, collective results. And I wish I had the magic answer to that. I think a good start, though, is really, and what I would hope for our county specifically is seeing more jurisdictions adopt a health and all policies approach to policymaking, and then collectively coming together to see where we have intersection of shared values and goals to ensure that we're able to meet some of those bigger indicators of success. So that would be my brief response to that, and then certainly invite my colleagues to share as well.
Yeah, we have a dream. Martine and Sonia and I have a dream that our health department and our county board of supervisors will adopt this and take it to scale, at least on the county level. We do have some partners that care about this work across the region. We have some key stakeholders in Monterey County and Monterey County that care about this. So we're hopeful for engaging other jurisdictions, other systems, so we could take the work to scale, because that's right. It's big work and you can't do it alone.
And both Shebra and I ran for re-election in the primaries in March. And so we were both re-elected to serve another 4 years, starting December through December 2028. And a lot of our decision to run for re-election was tied to continuing the work of health and all policies, to carry it forward, because Martine is terming off and we'll have new council members coming on. And so it was really important to continue this work and then hand it off,
And I do want to say, the three of us are elected officials, and I think we've been able to use those seats to move forward with some of these health and all policies, actions, and policy directions. And it doesn't take being an elected official to do this work. I mean, I was first introduced to it by someone who was doing the work within their health department. So I think just knowing that there are many entry points and many ways to show up as a leader of this work to see it come to fruition in your communities. But yes, also reach out to your elected officials and get them to be champions. So I think with that, I see we're getting close to our closing time. If there aren't other burning insights or questions, there's one more here. Let's see. Great. Yes. Okay. Thank you for sharing that insight, Marcus, and thank you for the work that you do in England. So I think with that, we'll go to the next slide, please. Okay, so you all played along with us and you wrote in the chat what you care deeply about. I plugged it into a word cloud really quickly, and this is what the word cloud gave. Clearly and appropriately, equity is at the center, and it's very big. You all care deeply about equity. You care about systems change, policy change. You care about uplifting the voices of those who have traditionally been silenced. Care about justice, courage, and the environment, community, safety. So this is who you are, and this is who we are, and this is what it takes. It takes us being rooted in these values for us to do the really difficult work that I know that you all do day in and day out. Challenges will come our way, challenges will come your way, you'll get pushed down. And when I'm rooted in courage and equity for myself and for all of you and for everyone, I'm able to get back up and do the work. So I wanted to start to have our close with just sharing with you. I'm deeply grateful. We're deeply grateful for who you are, for being here today. And with that, I'll pass it to Sonia to close.
Thank you. It's wonderful to learn about Sophia, and just I'm always amazed that other people exist in the world, and just hearing about some of the inspiration and examples that exist. And so just closing with this last slide, the next slide, it's a quote from Charlene Carruthers, who is a Black queer feminist and community organizer. And perfection isn't the goal, but integrity with our values is. And, I think that really says a lot as we move forward with thoughtful, inclusive policy that shapes our future and really is based on the values. And I'm just so excited to be here to do the work and to share the work and to hopefully stay connected in the future with all of you and others as we move to build more equitable and a resilient world. I love that previous comment in the chat about, just taking it bigger. So I love it. Thank you.
And I also want to say thank you so much. If any of you have additional questions for us or want to get in touch with us, we're happy to connect further at a future time to share more. But we really appreciated the opportunity to come today and to meet you all, and thank you for your work as well.
And we'll put our emails in the chat for you all.
Thank you to each of you for coming and sharing with us today. I found it very inspirational, and I think that others did too. So thank you again, and we will call on you to hear about the updates in the future. Please stay connected with our community.
Thank you. Have a great day.
Thank you.